Good morning, Dr. Staley. I was wondering, when a family member is experiencing a stroke and we have all these different agencies coming into our hospital room talking about the different types of care being provided for us, how do we know what the difference is?
Well, that's a great question because it's very complex. And there are three companies or three different kinds of services that take care of elders, particularly after a stroke or some bad surgery. And the first is usually called home health. And home health is paid by Medicare for folks 65 and older. And there's many companies in the Knoxville and East Tennessee area, for example. And these companies come out with either an occupational therapy, a physical therapist, or an RN for about 30 minutes to an hour. A physician does usually prescribe this for the companies. And so they do great work. And what they do is try to get the elder stronger, or maybe if it's needed antibiotics, they do that. And again, they're there for 2 days a week, perhaps 3 maybe, but they're only there for 30 minutes to an hour. That's the first kind of company. Now, in cases when people are very old and there's a debilitating stroke or something, the cancer is determined life-threatening, then you may move 25 years down the road, and these are called hospice companies. And hospice is another great service line that does the same, paid by Medicare, so all these companies that do hospice are able to assign a nurse practitioner or an RN, and they come out and give palliative care, maybe analgesics to decrease pain in cancer patients, etc. Now, the challenge with all that is these companies, both home health and hospice, while paid by Medicare, they're only there a couple of days a week for 30 minutes to an hour. And that's great. But what happens to the elder in the continuum? What happens to who's going to take them to the appointments? Who's going to make sure they're up and get out of bed, or they don't fall, or they need a bath? Well, that's where personal home care companies come in. And so the bridge between the start and the end of life for a lot of people is personal home care. Now, your home team care, which is a company, I'm Dr. John Staley, president of that. We do take 5 insurances so that mitigate any cost, out-of-pocket expenses. Department of Labor, VA, long-term care. We also do ETHRA and work with underprivileged in TennCare, which is the Blue Cross Blue Shield. So we do send experienced nurses out to evaluate, along with physician-managed and nursing-managed, so we can get an assessment of what the elder is going to require, and that's free. And so customized care can come from anywhere from 1 hour a day to 4 hours a day to 24/7. So that's what the complexity is, to know you're going to need home health in most all circumstances, and you probably need some combination of personal care. The hospice, the end of life, is only if somebody's very elderly or there's a debilitating event. I hope that's clear. If you like this video, YouTube, follow us on other YouTubes and social media. We're your home team care, 865-332-5000. We're local, and we're nursing physician managed, and we're delighted to come assess and see you. Have a great day. Thanks.